We've actually seen a clearly declining trend in the number of patients in intensive care and also in the number of deaths since the middle of April. And for the moment, we're down at very low numbers, both in intensive care and in terms of the number of deaths. The Swedish people have really followed the recommendations of the Public Health Agency quite clearly. There were studies already in April showing that 93% of the Swedish population had changed their behaviors quite drastically in terms of social distancing. Higher education was closed. Most people who were able to do so worked from home. Very few used public transport. And most people really have kept a distance to their elderly relatives.
Now, there's talk about this so-called herd immunity, which was never officially a part of the Swedish strategy. How close would you say that Sweden is to possibly reaching herd immunity, or what role would you say that immunity is playing in terms of making sure that the numbers stay down?
I think it's a combination of people following recommendations very closely, which has led to reduced transmission in the population, clearly from early April. And we see that the reproductive rate has declined. It's the most recent number is around 0.6, which means that the epidemic is also sort of declining. But yes, we do see that the number of people with antibodies is also increasing in Stockholm, which is the most affected area. And there have been preliminary studies also showing that there might be so-called T-cell immunity, which is another way of measuring immunity, which may be twice as high as the antibody level. But those are still very preliminary results. It could be, it's really hard to say. But I think both of these factors, that people have really followed the recommendations, which has made the infectious rate go down, and that there might be an increase in immunity. But also now, because we have vacation times and a lot of people are spending more time outdoors, I think that's also very important. And many people are on vacation and are not using public transport, don't go to the office, etc. But we've seen that the same trend throughout the spring, actually.